Are you interested to register as a nurse in Ireland, but you do not know what the exams you're going to write looks like? If you'll be able to pass? If the people that are going to be monitoring you during the exams are registered nurses, they'll be able to detect when you make a mistake? Are you going to be writing exams in your home country, or you have to travel to Ireland? What and what will I be asked during the exams? If these are the kind of questions in your mind, then you are on the right channel. Make sure to keep on watching all the way to the end, because I'm going to take my time to explain these for you to understand what is involved. Now, what exams am I talking about? In Ireland, for you to become a registered nurse, after getting your decision later, there are mainly two options that you have to go through. It is either you do the OSCE and CBT exams, or you do what is called the adaptation. I have made videos of the overview of these two. They are on my channel. Make sure you check them out. I may also link them to the description box of this video. I'm also sharing my experience of how it was during the adaptation, but mainly in today's video, only the RCSI exam is what I am going to be explaining. What is it about? Now, this exam has two parts, the part 1 and the part 2. The part 1 is the CBT exams, computer-based test, just as the name implies. It's actually an OBJ kind of questions, and sometimes 1 or 2 questions for you to write. So according to the people who have written these exams, I did not take it, so I'm explaining this based on people's experience. So the part 1 exams, like I mentioned, is the CBT. It has about 300 questions, and you're expected to score at least 50% to be able to pass. You have 2 attempts at these exams. If you take the first one and you fail, you can have a repeat. If after the repeat and you still fail again, then you will have to start your process all over again, because you will not be eligible to take the part 2, which is the OSCE. So these questions are OBJ, and there's like a 2 question where you have to plot, like answer questions about INEWS, escalation protocols, calculations of medications, something like that. Now, in people's experience and what they have said, if you have been a registered nurse currently practicing, you should be able to pass. There are just very few people who have had to repeat the CBT part of these exams. Now, after you have passed the first one, you can now move to taking the part 2 of this exam, which is the OSCE. Now, for young nurses who are in this era of OSCE, they already know what OSCE is about. For those of us who have already passed through nursing school before the OSCE was introduced in some parts of the world, it is just same as the practical exams that we usually take when we were in school. We have to go to the hospitals, use patients, and then our examiners will ask us different questions, and then we respond. We could be asked to perform a procedure, we could be asked to teach a patient, we could be asked to teach students who are coming on clinical placement. So things like that is what you're going to also be seeing in the OSCE here in Ireland. Also, before I forget, the exams is taken in the Republic of Ireland, not from your home country. So you need to be here before you'll be able to register. The cost of this exam is €2,800, which is paid directly into the bank account from the banking hall or in the banking hall without online payment. So you cannot use your card. You have to go into the banking hall before you'll be able to register for these exams. RCSI stands for Royal College of Surgeons Ireland. It is a very big institution here in Ireland, and they control a lot of things. They have a lot of courses. They are the people that organize these exams for overseas registered nurses seeking to have their name entered into the register of the Nursing and Midwifery Board of Ireland. So I have some jot downs here that I'm going to be looking at in case you see me looking down. So this is just to give like a breakdown of what the exams looks like and what is expected of you. If you go online to the RCSI website and to the overseas aptitude test exams, you're going to see what is called the minimum background reading. So that is where I get all of these things from. You could also see them there. They have a lot of literatures, a lot of informations that you need to pass these exams. There is nothing that is going to be asked during the exams that is not already on that portal. Now, mind you, they keep updating this information, so you need to keep yourself abreast with this particular website if you are willing to pass these exams, especially at first sitting. Now, just like the CBT, you have the opportunity to resit these exams if ever you fail any of the stations. They have 14 stations for these exams. This could be changed probably by the time you're watching this video, but from this day I'm making this video, it is still 14 stations that you need to pass. So these 14 stations has different scenarios, different questions, some of which could be asked in two separate, like the same questions could be asked in two different stations, which is, in my opinion, more like a bonus for you to be able to pass. You have opportunity to retake the exam, like I said. So there are 14 stations. Assuming you, maybe the first sitting you missed, you couldn't make it in like 2, 3, 4, 5 or 9 of the stations, you have the opportunity to resit only those stations that you pass. So at this time you are more like streamlined on the ones you're studying for. So the first I'm going to talk about is the admission stations. Just like the name implies, this has to do with your first contact with the patient when they are going to be admitted into the ward. So this is more like a ward based. So the scenario that you are going to be asked something on how to assess the patient. There are different assessment tools here in Ireland. They have the FALS, which is the false risk assessment tool. You could be the Waterloo and skin bundle. So this is when you're assessing patients if they have risks of pressure ulcers. If they have, then you know how you are going to manage them, what kind of mattress you're going to be using, and all of those stuff. Then for the false risks, you want to assess your patient to see if they are at risk of falls, how highly are they likely to fall during your care or within them receiving care in the hospital, and this will give you a baseline on how you're going to be managing these patients. So under this, if your patient is at risk of fall, then you need to set out some certain modes. Is it to keep the floor at bed that there is no wire connections? Is it to get someone to be there specifically for that patient, like a healthcare assistant or a support worker? Is it to make sure that you admit this patient closer to your view so that you would see? Is it to get like some mattresses and bed rails up? We are all nurses and we know those things that we should do to be able to prevent a patient from falling. Are they like a sickness, the kind of clothes they wear? Is it because of their mental issues, maybe like confusions and stuff like that? So on that website you have a whole lot about this topic I'm talking about that you can read about. You could also be asked questions of malnutrition. So there is a tool called the MUST tool, where it's used to examine patients if they are at risk of malnutrition, so that they'll be able to know the relevant multidisciplinary team that needs to be managing these patients when they are in the hospital. So those are some of the tools and the questions you could be asked when you are. So all these tools has like scores, has interpretations. When you go online, you're going to hear all of this stuff, and then the assessor or the examiner is going to be asking you questions, pretending, because they use like a mannequin. So the mannequin is there. If there's anything you're going to do for the patient, you'll be doing for the mannequin, and if there's anything the patient needs to be asking you, then the assessor is going to be asked. So it's more like dramatization of what will or is happening within the hospital facility. Next is wound dressing station. As we all know, wound dressing is a very sterile procedure. So here, even back home, when we are doing exams and we are asked to get a patient's wound dressed, you already know that there are some things you shouldn't do or should do in preparation for wound dressing, which is, if you are going to sweep the place, you need to sweep everywhere, allow the dust to settle, and then you dust off the dust, open your nearby windows, let the dust goes out, and by the time you're ready to dress this wound, you need to close nearby windows, you need to close curtains to provide privacy, you need to explain the procedure to the patient, make sure you maintain sterility all through the period of the wound dressing, and also the wound dressing pack that is used, you could order it. If you watch videos about UK OSCE wound dressing, it's something similar from those who have taken the exam, something similar. So you could watch that and probably order the wound dressing pack from online to be able to practice it at home. With the same thing that we do, just that the packaging differs and the way they do it differs. The technique, and should I say the principle, is the same, just that the materials differ. So that's one of the stations that you will be undergoing. Next is the east bar station. In my previous video, when I talked about interview for nurses, I talked about east bar. It is a tool used for communication. Here is the same way we communicate back home, just that here you need to write those things down and it will be attached to the patient's file. ISBAR, ISBAR. Okay, I don't want to go into the full details, but you can see the full details on the website. So in this scenario, you could be asked to assess a patient, or given a scenario in things like a patient comes into the ward with so condition and now is complaining of so condition, then you are required to ring the doctor to let them know what the update on the patient situation is. So you're going to be filling the information here, filling the identification, filling the situation, background, assessment, and the report that you're going to be giving to the doctor. So you write your identification way, because before you call anybody, you need to call, hello, this is me, do it. So I'm calling from so ward, am I on to Dr. Obi? And the person says yes. Okay, I have this patient that was admitted in the ward 2 days ago, following this and that, just did an assessment, find out this and this about this patient. In my opinion, I think this is what and what that may be happening to this person. Do you think I should go on to do this first? Are you okay to come to the ward? And also, depending on the kind of thing that you are assessing or you think might be wrong with this patient, so the doctor might need to come in immediately, might need to come in 15 minutes time, might need to come in 30 minutes or in an hour, or maybe come in later in the day whenever he had the chance. So this is where your critical thinking, is going to come into play as a nurse, for you to be able to assess and know exactly what is wrong with this patient. Even though it is not in your place to diagnose, you could suggest, I could start doing this, patient's running temperature, I could start exposing, I could start doing step, things like that. That's what actually, so ISBA is just you communicating to another person what might be wrong with the patient, what your observation is. That's entirely what the scenario is about. Full details on the website, like I said. If you have watched up to this point, it means you're liking the video. Please give this video a thumbs up so that YouTube can recommend it to as many people as they want. Now, the next could be IPC, that is the infection prevention and control. In this particular scenario, you have so many questions to answer that revolves around infection prevention and control. It could be for you to demonstrate hand washing. It could be for you to, so something like hand hygiene. So it could be like you demonstrate hand washing. So there's difference between hand washing and the hand rub. And when you're doing this thing, you could be asked some questions. How long should it last? The step by step on how to do your hand washing. Make sure you go through this. This information is available on the website. Hand washing is also available on the WHO, because they're actually using the recommendation given by the World Health Organization for the hand washing. So you could be asked question on how to prevent infections in the ward. It could be by patient placement. It could be by you assessing patient by the time they come in to know the kind of infections they have. Is it MRSA, CPE, CRE, VRE? What steps are you going to take if you have patients that is having these kinds of infection? Like I said, I have not taken these exams, and to the best of my knowledge, videos like this are not always that circulated. So I'm just going to give you bits and pieces there. If you are interested, or if you are on this journey, head on to the overseas aptitude test website of the RCSI, and then you will see a whole lot of this. You could also reach out to people who have written these exams to put you through on some things, so that you have the full knowledge of how the thing actually looks about. People pass these exams, people fail it, but I am yet to see people who like took their time to read through this website, try to practice these things at home, fail these exams yet. Next station could be medication. Just as you know, the name medication is a very sensitive aspect of nursing care. You know, you need to wear like the cloth, do not disturb medication rounds. You do not forget that you could be asked to administer a particular medication. Now on the website, there are a list of different medications that you could come across during these exams. There are more than 20, and they are commonly used medications. So you need to go through and know all the actions, the mode of action, the name, the indication, contraindication, anything like precaution, any maybe like age restrictions, that things like that that comes with medication. And you know, when you are administering medication, you need to tell the patient what medicine it is, why you're giving, the expected reaction of that patient, any adverse effects that may occur. And also do not forget to let the patient know if you experience any other symptom outside of these ones I am telling you. Please do not forget to let me know. Make sure the call bell is always available for the patient to call you. So that is the kind of questions you're going to be seeing in the medication station. Next could be the INEWS. So INEWS, INEWS, is just like saying the news score, National Early Warning Score. So the I there stands for Irish. So Irish National Early Warning Scores is the same thing as per the vital signs that we do back home. The only difference between the vital signs and the INEWS is that the chart comes with a way that each and every parameter that you take for a patient has a score attached to a number range. Let's take for instance, if you are taking a patient's temperature and the patient temperature is between, let's say, 36.2 to about 37.2, which is within the normal range, the score could be 0. If it goes above that, the score could be 1. If it goes above a particular range, the score could be 2. So the rule for the INEWS generally is, if you have any new score of 3, you need to escalate immediately, and the patient needs to be reviewed immediately, updated, inform your line manager. So they have all of that for temperature. What do we have with the vital signs? So it starts with temperature, respiration, oxygen saturation, consciousness level. So all of that comes within the form. You'll be given the chart to take all this in. So the way people say, they will ask you to take your own vital signs and then record them and then escalate. So if maybe you take your own vital signs and they are all within the normal range, they could give you a score just to test if you truly understand what the chart looks like or what you should do. So within the INEWS, they have the escalation protocols. If you have the score of 0, if you have score of 1, if you have score of 2, score of 3 or more, if you have a total, so when you add all of it, there's a total score. So even if the total score is like 3, which is not a problem, but that the 3 was scored 3 in a particular parameter. Let's say you take a patient's pulse and you have a patient's pulse of like 40, that has a score of 2. You need to escalate that because 40 is not normal for somebody to have that kind of pulse. And if you're taking a patient's temperature and it is 50 degrees Celsius, and then that's the score of 3, and in your total INEWS is like 3. So even though it is 3 in the total, because 7 and above is what you should be escalating, but because the escalation protocol says if you have 3 in any of the parameters, you need to also escalate immediately. So that's the kind of questions that revolves around the INEWS station. That's the kind of things you might be seeing. So that's one of the stations. I don't know if you were counting, that's like number 6. And number 7 could be the chest infection station, where you could be asked to talk about incentives, spirometry, oxygenation, nebulization, vaccines, both the flu and the pneumococcal vaccine, and respiratory or cough etiquette. So we know when somebody is coughing, the cough etiquette, make sure that you cough within the cough end of your elbow, not use your fingers. When you get home, you wash your hands. And if you are taking the vaccine, it's once every year around I think November thereabouts, to protect about the flu that coming during Christmas period. If you are talking of the incentives parameter, which is like this equipment they give to patients that recently undergo any surgery, just for them to be able to exercise their heart muscles, respiratory stuff like that. So that is one of the stations. Everything explained is on that website. You could check that out. Next could be the therapeutic communication station, where you may be asked to break bad news. And you know, when you're breaking bad news, there is a pattern for it. I think it's called a spike framework, or the spike model. So you do not just call somebody, hello, Mr. Amadi, your father is dead though, where you there, abeg? No, you can't say something like that. So this is bad news that you're going to be breaking to someone. You need to introduce yourself. My name is Indue, so I am the nurse taking care of your mother today. Am I on to Mr. Amadi, the son of Mr. Obi? Say yes. Oh, where are you? Are you alone? Say, because this is something that might make somebody to potentially go into a crisis. This kind of news is not palatable. Are you alone? Is it okay if I speak with you about your mother's health? The person will tell you, oh, it's fine. Oh, can I get home? Do you need me to get my wife? Do you need somebody around? You ask this kind of questions, and okay, you start saying, your father was in a very critical condition, and you start explaining. By this time, they're already tense, but because you're taking it slow, you give them bit by bit. You don't just bump everything into somebody. So that's why we have this spike framework. You can read about it. You could be also asked to break bad news about maybe a new diagnosis. Let's say somebody is being diagnosed of cancer. A patient came into the clinic to run some tests to see if and then unfortunately there is a cancer diagnosis. You could be asked to break this bad news. So you make sure you use the spike framework, where you make sure somebody is there to, if somebody needs to come with the partner, if with the child, is the child old enough? Do you want me? Stuff like that. How you be able to communicate with somebody, giving them bad news. Should I call it compassionately, empathetically, and stuff like that? That's some of the scenarios. Next could be patient teaching. When a patient is newly diagnosed of any disease condition, it is always pertinent that we let them know. Now, this is what we've done. I have done this severally. Patient coming into the ward, they want to go for surgery. They want to know. In fact, before this time, the doctors may have told them, but most times it is we nurses that are always this way. So we can see they are tense. We can see we need to give them. So they could maybe diagnose of COPD, could be diagnosed of cancer, could be diagnosed of anything. So you need to teach them what the condition is. So the list of the conditions, you would see them under the minimum background reading, like I said. So it keeps changing. Most times what you hear about is like COPD, asthma, osteoporosis, constipation, colonoscopy, gastroscopy. So the things could come like a scenario leading to it. So because this and student teaching station, these are two different stations, but they kind of intertwine with each other. So it could be something like you using your critical thinking. So a patient was admitted into the ward. A few days later, I couldn't go to toilet, couldn't do this, couldn't do that. What the diagnosis came out to be constipation. What do you think could have been done differently? So that could come in a patient student teaching station where you're going to be teaching the student nurse what was over, should I say, what was missed. So probably you did not take the patient dietary requirement into consideration. You did not take the patient's current medication, because some medications could potentially cause constipation, and because these things were not done, that could, you need to go back and do them again. And because this patient is already suffering from constipation, you need to teach this person what constipation is, how it could have been prevented, how it is prevented, how it will be managed. And when you're talking about management of any condition, you do not just jump into the big ones. For example, management of constipation, the next thing you're talking about is prescription of laxative. No, it could be dietary, where you just have to increase your fluid intake, increase your fiber intake, increase the amount of fruit you eat, and then you just keep monitoring it, and then you could not talk of laxative. So the examples of those ones are also given in the medication list I talked about during the medication station. So you could read about that. So there could be also like an acute station where you talk about these issues or disease conditions that happens acutely. So it could be acute abdomen, angina pectoris, could be what did I compartment syndrome. That's for like patients just coming back from surgery. And, the management for angina is usually like the oral tablets that they give them under the tongue. This is online video, so I cannot be mentioning medications before they will say this person said it, because remember, medication has to be prescribed. Okay, so it could be something like that, where you are talking about, we take the first dose, after 5 minutes, check your symptom. If the pain is still there, check your symptom again, administer again, and then you take your blood pressure, because this medication, if you're a nurse, you already know, potentially reduces blood pressure because of vascular dilation and all of that stuff. Okay, remember I mentioned like oxygenation in chest infection station. So you could be asked to administer oxygen to this patient. Remember, oxygen is a medication, it has to be prescribed. You make sure you check the prescription cardex. If it was nebulization, all of this has to be prescribed. But if it was like a very emergent situation, then you need to explain. So you are talking, you are doing. So that's how practical is. Okay, that's how it also is in OSCE. Next could be the sepsis. So sepsis is something that they are, because I think the story is because it's usually missed. You need to know what sepsis is, signs and symptoms of sepsis, then the sepsis 6 bundle, which the form is available on the website. The sepsis 6 bundle is actually, like a laid down protocols, principles that is used to manage any patient that is septic, at risk of being sepsis, or is already going into septic shock. Okay, so you need to know all of that, because you could be given the form and given a scenario with parameters for you to fill into the form, and then talk about how you're going to manage this particular patient. Even though it's a fictional patient, you also need to give like a fictional management. I hope that is clear. It could be also be the IV priming. So this is the infusion infusion administration stations. So you could be given, like, there are different infusion, there are 3 types: the isotonic, hypertonic, and the hypotonic. So there are different types of fluids which are also listed on the website, where you need to know if they are given a fluid like a normal saline, what kind is it? Hypertonic, is it isotonic, is it hypotonic? What are the indications, contraindications? How do you manage it? So you could also be asked to calculate like the rate per minute, per hour, how long it going to take for the patient to completely take this medication. You could also be asked to administer this to the patient in during your exams, so you need to know all of that stuff. And also the renal station is the kidney, so it could be urinalysis. For urinalysis, people say they are asked to like carry out urinalysis, and the urine strip that has the combi 9 or 12, that has everything, that one. So I may post it here. You need to know how to use it, because some of us don't know how to use it, because most times the analysis we do in the ward is just if you have a diabetic patient, that you're only taking the sugar level. So this has sugar, blood, protein, bilirubin, urobilirubin, different kinds of things you're looking out for when you're doing that urinalysis. So the color, the consistency, what it looks like. We back home we had a formula, something like Dockers, I think so. So you need to know how to know, and then the normal urinary output for adults, for children, daily output of a particular person with with a particular kilograms of weight, excreting so meals of urine per hour. What will the total be like in 24 hours, 46 hours, and thereabout? So you could be asked to mention all of these things. So you need to know, they are all on the website. It could also be like the COTI bundle, is the you taking care of a patient who is on catheter. The form is there. So it has something like, why are you giving injecting catheter? The reason is because there should be a reason before. Catheter is very, should I say, is one way ticket to somebody getting an infection, be it male or female. Okay, so it's not something you just give, you put into somebody without a valid reason. And also, if there was a valid reason, you put it at that time. Is there any reason you should keep it there for 1 day, 2 days, 3 days, 1 week? So you need to explain all of that. They are all written on that form. How you teach the patient how you can collect midstream urine for female, for male, if you're asked to do that, and preparation and all of that stuff. So these also come into this. Could talk about something like stress incontinence, where you could talk about stress incontinence, where you explain what incontinence is. Is it by stretch, or what are the factors that lead to somebody having in this urine incontinence in male and in female? So all of that stuff, that's why I said it's just everything we have been doing back home, but in a more standardized way, because there are assessment tools, there are forms that you need to fill in all of these things. End of life station, this is just like end of life. When you have, like, in a long-term facility, somebody who is actively dying, how you care for this person. You need to there are so many things involved in end of life, actually. If there was a wish for the family to be around when this person is dying. So remember, when we talk about ISBA, this is one of the places that you might need to use that tool, just so you call the family member that their loved one is actively dying, is almost dying, or stuff like that. Maybe you just went into the ward to assess a patient, and you see the breathing is not so regular, the patient is struggling to breathe, and you're trying to reposition, it's not going. That could be one of the signs that the patient will be giving up in no time, and they had a strong wish to be there when their loved one is dying. It is a very common thing here, because they have like older people who death could be predicted, sort of, and they have come to that conclusion, or to that reality, that their loved one is not going to recover, but they just want to be around when they are taking their last breath. Okay, and you need to call them and let them know. So that is like the overview of the 14 stations. So what are the tips, should I say tips, tricks, or how you should pass this exam. Now, if you go to the website, they will mention like there is also failure rate, and they have discovered that the reason why people are failing this exam is because of lack of preparation. Yes, some of us graduated many years ago, and we are only just practicing in one particular ward, one particular unit, and we are coming here. This is general nursing. You are going to be registered in general nursing, so they are still expecting you to know everything a new graduate nurse in Ireland should know, notwithstanding the fact that you graduated 20 years, 40 years ago, and you might have been streamlined in your area of practice. You still need to know all of these things. So how do you prepare? What do you do to be able to pass this exam? Preparation. Prepare. How do you prepare? Go onto the website, download all of the. I remember when I was still in preparation to come, because I never knew I was going to get adaptation. And even though you're going to get adaptation, it's still good to know all of these things, because it's just refreshing your memory about general nursing in its entirety. Download all of these things, print them out if you are somebody that is only like reading hard copies. Read them line by line, word to word. You'll be able to know. There are sample questions for the CBT, just showing you what. It's not like the entire thing. They are like about, I think, 5 or thereabout, showing you how the CBT questions are asked, so that you have an idea about them. So download these things and read. That's one of the next thing I will also do is practice. Imagine yourself being in a scenario. Ask yourself different questions. If you were to be the examiner, what will you ask in all these scenarios? How will you answer them? If the student says this, will it be okay for you? And also remember that when it comes to practical exams, there are things they can overlook, and there are things they will not overlook. If you are going to do wound dressing, and then you are picking you are using the clean forceps, picking the clean forceps, and then you're using the same hand to clean, using the same hand you clean with the forceps to go and pick another one again, like you are just reinfecting everything, and that wound is definitely not going to heal. You also, in wound dressing station, before that, now that I remember, you need to know like the stages of wound healing as well. So, and also maybe if you are giving oxygenation, somebody, you are going to use the nasal cannula, and then you went and use face masks, use nasal cannula and then increase the flow. So you need to really take time to practice. There are some of the things as well, like taking permission. You do not go about touching people without taking permission. You are asked to go and administer medication, and you've not taken permission from this patient. Hello, my name is INEWS, so I am the nurse that will be taking care of you today. It's time for me to administer your medication. Is it okay for me to do that? And then they'll have to agree, yes or no. If they agree, you go ahead. If they do not, then that's a medication refusal. Remember, this is a scenario. It could flip. As you are administering the medication, the examiner tells you, no, I don't want to take it. They are testing you if you know what it means for a patient to refuse medication. What are the necessary steps you're going to talk about? This particular question, I have answered it in my interview question. What should you do if a patient refuses medication? Yes, I've answered it. So make sure you go and watch that video. You understand what you should do. Apologize if you make a mistake. If nobody is above mistake, we all make mistakes in one way or the other. As long as it is not something that is going to, end someone's life. You need to accept your mistake. In fact, one way to make you stand out as a professional, in my opinion, is ability to be able to accept your mistake. Because when you accept your mistake, it means you are teachable. You've acknowledge the fact that you've made a mistake. Then you can sit back and see why you made that mistake and how you're going to rectify it, and make sure that you keep things in place to make sure you do not repeat the same mistake ever again or in the foreseeable future. Remember when we're taking practical exams, maybe you do something and you just miss a step, and then your examiner just give you a hint. Don't you think you're supposed to thank you? Oh, I'm sorry, ma. You move ahead. If they tell you something that you did wrong and then you are trying to argue things. It doesn't really make any sense. And maybe different people may react to it different way. And you know what I mean by that. And so these are some of the things you would may likely have to do. And I hope you understand what the RCSI in its entirety looks like. That is just an exams, one of those exams that anybody, any registered nurse can write. And remember, they are not expecting you to be perfect. They are testing you as per a new graduate nurse in Ireland. They are not testing you as somebody who have been practicing for 50 years. No, they are not. They know you're human. You can forget things, because remember, you're doing all these exams in one day, so it's very possible for you to forget some things. But if they just maybe give you a hint, you remember. And you will not remember even though they give you a hint if you did not study. So study, study, study. Thank you for watching this video up to this point, and don't forget, my name is INEWS. So if these are the kind of videos you like, please subscribe, turn on your notification bell so you don't miss any of my videos. For now, bye bye.